I'm Akitomo Motoi, the president of Toei Shinyak Co. Limited. So this is my picture. I took this photo last year in Brazil. So this huge mushroom is the Agaricus blazei, our King Agaricus K21 strain. So today I'm going to introduce about the evidence of King Agaricus K21 using this slide. So here is today's topics. First, I'm going to introduce about the medicinal mushroom, Agaricus blazei, or Agaricus brasiliensis. And next, I introduce about our own King Agaricus K21, the name of this mushroom. And the third point is evidence of K21, mainly how to improve the immunity and the evidence about the antifungal infection and wound repair and hair growth. And the last part, I'm going to introduce about the recent research and the summary. So first, let's move to what is the Agaricus blazei. So Agaricus blazei is a medicinal mushroom originally grown in Brazil. Academic name is Agaricus blazei or Agaricus blazei. These two academic names used to use. But these days at the academic conference, many people use Agaricus brasiliensis or Agaricus subrufescens as academic name. And this mushroom is known as mushroom of the sun because this mushroom has strong vitality and survives under the sunshine. Also, this mushroom is known as mushroom of God in Brazil. And the main component is beta-glucan, 1,3 and 1,6. And it contains rich minerals, iron, potassium, zinc, copper, and magnesium like this. And it also contains rich vitamins, vitamin B1, B2, B6, and the others. And Agaricus is the most popular immune booster in Japan. According to Japanese survey on cancer patients, 26% cancer patients took Agaricus as immune booster in Japan. At that time, Agaricus is sold well, so the percentage is really high. And also, cancer patients who took immune booster, they selected Agaricus more than 60%. But the Japanese government has, according to Japanese government, Agaricus blazei, these components and efficacy and safety are quite different among strain, cultivation method, and processing, and origin, and the part of mushroom. We see this picture. There are two mushrooms, but actually these are also same. Both of them are Agaricus. Same strain, K21. Origin is also same from Brazil. Just the difference is cultivation method. On left side is outdoor, and right side is indoor cultivation. So if the cultivation method is different, the appearance is totally different, like these pictures. From here, I'm going to introduce about the cultivation method and origin. At present, nobody cannot harvest the natural Agaricus in the nature. Very similar to nature, Agaricus is outdoor cultivated Agaricus. So outdoor cultivated Agaricus contains rich minerals and rich vitamins and strong effect. So many Agaricus companies try to cultivate outdoor, but it costs a lot and very difficult to harvest. So these days, normal cultivation method is indoor greenhouse. Indoor cultivation method is used in Brazil and Japan and China and USA and etc. Only we, Toei Shinyak, have some knowledge. To cultivate outdoor, we need 3 elements. One is wide nature environment in Brazil. And second one is special compost for outdoor cultivation. And also we need strong strain, K21 for outdoor cultivation method. We have these 3 points we have, we Toeshing have these 3 points. We only can use outdoor cultivation in Brazil. And please see the right side. This is tank culture. What is a tank culture? I'm going to introduce about this. So before explanation about tank culture, I need to explain about the part of mushroom. Usually the mushroom is divided 2 parts. One is food body. Usually we eat food body. But the other part is mycelium. It is a root of mushroom. So tank culture is culture the mycelium in the tank. The tank culture is used to do in Japan, but there is not so many academic evidence, including safety and efficacy. These days, just few companies use the tank culture. So main cultivation method is outdoor and indoor. So I'm going to introduce about the difference between the outdoor and indoor. First, I'm going to how to cultivate indoor. Many people listen the name of indoor or greenhouse. Many people imagine this kind of picture. But actually, the indoor cultivation of the agarics is in this dark area to avoid the sunshine in the artificial environment. So originally, agarics is named as mushroom of sun. They glow in the nature under the sunshine, but in greenhouse cultivation method, they avoid the sunshine. So the mushroom grows very small and the component is very low. On the other hand, outdoor cultivation method. So you can see the field. So agarics is to move the grass on the field. Agarics grown like this. So the agarics, outdoor agarics is grow directly from the land. Here is the environment of outdoor cultivation. The picture in the picture in the Brazil, I took that picture. So there is no artificial facilities, including the factory. The air is clean and water and land is clean. So we cultivate in this wide nature. And we also cultivate without any pesticide. Then, so outdoor, so far I introduced about the outdoor cultivation method. And the outdoor agarics is like this size, as I mentioned, and the size is very big, like this picture. Each size of mushroom is almost same as my face and very huge. And the difference is not only in the appearance. Also, there is a big difference between the in the components. Left side is beta-glucan, the main component of agarics. This color is King Agaricus, outdoor cultivation one. And the right side is the other agarics, greenhouse one. So the component of beta-glucan is totally different, 1.5 times more than greenhouse one. Also, outdoor agarics is cultivated outside under the sunshine, so it contains rich vitamin D comparing with the greenhouse cultivated indoor. Also, here is a comparison of nutrition. In Brazil, there is a red round. It contains a rich mineral, including iron and copper. And we just cultivated just one time. We to make good agarics contains rich mineral and vitamins. We cultivated. We harvest just one time. We all time cultivate new land. So the difference is here. The green one is greenhouse Japanese one. And the brown one is King Agaricus, outdoor cultivation in Brazil. And rich outdoor King Agaricus contains rich calcium, iron, and selenium, vitamin D, B1, and copper. Also, there is a big difference on the effect. This comparison is about the antioxidative activities. The left side is King Agaricus outdoor in Brazil, and the middle one, center one is King Agaricus indoor cultivated one, and the right side the Japanese indoor one. So comparing with Japanese indoor, the activity, the antioxidative activity of King Agaricus is 5 times more than stronger than this kind of Japanese indoor Agaricus. So far, I introduced about the difference between the cultivation method and origin. So our King Agaricus is cultivated outdoor in Brazil. So the appearance and the nutrition is totally different comparing with the indoor. So we named this Agaricus King Agaricus. And also we use the strain is Ka21. So let's move to the next topic. What's the King Agaricus Ka21? So Ka21 is Toei's own strain name of Agaricus brasiliensis. This Ka21 strain can be used for outdoor cultivations thanks to its strong vitalities. And this Ka21, this strain is registered at International Patent Organism Depository in Japan as King Agaricus 21. So shortly, we call Ka21. And we have published many papers as Agaricus brasiliensis Ka21. Also registers at trademark in EU. Here is a register at the International Patent Organism Depository as King Agaricus 21. So shortly we call Ka21. Here's academic papers. The upper side is improve immunity, related to improve immunity. So we published as Agaricus brasiliensis Ka21. Also the bottom side is antifungal infection, also published as Agaricus brasiliensis Ka21. Also Ka21 is also registered as trademark in Europe, like this. So let's move to evidence of Ka21. First, there are many research papers related to Agaricus, and we, Toei have published 32 papers on Agaricus blazei as #1 Agaricus research company in Japan. Here is the other companies. We published 32 as #1 Agaricus research company. According to our study, first I want to introduce about the safety data. We do the mice test about mutagenicity and genotoxicity, and we confirm the safety of the test. Also, we did the human trial. Please wait a moment. We did many human trials about the safety data. One is normal dosage, 1.5 gram a day for 3 months and 6 months. We confirm this normal. We confirm the safety by this normal dosage. Also, we do the overdose test. 9 gram a day in human, 6 times more than normal dosage for 6 months. Then we have no no side effect has been reported. After we confirm the safety of our Agaricus Ka21, so we started to check the efficacy of King Agaricus Ka21. These are the evidence about our Ka21. So first we had started the research about improve immunity, but after that we confirmed many effects of like this: antifungal infection, reduce the side effect of chemotherapy, protect the heart and liver, diabetes, also improve the fur condition, and live longer. So today, I want to introduce about, I want to focus on improve immunity, including antifungal infection, and reduce the side effects of anti-cancer drugs. Also, quick recovery after injury and surgery. Is it okay?
Sorry, yes, everything's fine, sorry.
Okay, I see. Okay, so first I'm going to introduce about the evidence of improving the immunity. So how does agaricus improve the immunity? So I want to introduce about the mechanism of the improved immunity using the slides supervised by Naohito Ono, professor of the Tokyo University of Pharmacy and Life Sciences. First, agaricus, mushroom, including agaricus, is vegetable? Of course, no, it's fungi. So this picture is on left side is agaricus blazei, and the right side is mold, candida. The appearance is totally different, but the mycelium, the root of agaricus, this picture is very similar to the mold and agaricus, mycelium of agaricus. And beta glucan is the component of the cell walls of fungi. Left side is the type of agaricus, 1,3 beta glucan and 1.6 beta glucan, like this model. And the center is Spalacis crispa, the other type of mushroom. It contains 1.3 and short 1.6. So when the type of mushroom changes, also the type of beta glucan is changed. But please see the right side. This is the Candida albicans, a beta glucan of Candida albicans. Candida is a pathogen caused mouth candida, like this, like mouth candida. But please see the agaricus and candida. The appearance of beta glucan is very similar. This similarity is very important to improve immunity. So what happens after we take beta glucan? So other components like nutrition, vitamin and minerals are absorbed at the intestine, but beta glucan is not absorbed in the intestine and go directly to the intestine. And in the intestine, many immune cell is ready to fight with against the pathogen in the intestine. So when immune cells find beta glucan in intestine, as I mentioned, the type of beta glucan between agaricus and candida are very similar. So when the immune cell catch beta glucan of agaricus, they consider pathogen invaded. And then to protect against the pathogen, the immune cells switch on against the pathogen to start to fight. The first, innate immunity are activated, including natural killer cell activity. It's related to improve immunity and also related to anti-cancer or prevent the infection. Very, very important to the anti-cancer and prevent the infection. The later, acquired immunity is also stimulated, and the anti-beta glucan antibody are produced. And this anti-beta glucan is react to the agaricus, also reaction both agaricus and beta glucan of pathogenic fungi. According to this mechanism, agaricus has antifungal. Agaricus is very useful for antifungal infection supplement. So beta glucan, the main mechanism of stimulated immunity, the beta glucan is not absorbed. Beta glucan stimulates immune cells in intestines. And this is more academic data, academic last. To the right side, there's a dendritic cells. It has the dendritic cell. There is a DICT1. This is a name of the receptor. DICT1 is binding to beta 1.3 glucan, and after them they stimulate, they get a signal and release the interleukin 6, 12, TNF alpha, and interferon gamma to stimulate the immune cell. So here is the human trial related to the natural killer cell activities. The left side is Agaricus group, the right side the placebo group. And this data is about the human volunteers. They took 3 grams a day for just 1 week. The left side Agaricus group, and it shows natural killer cell activities. After taking 3 grams a week, the natural killer cell activities improved like this. And there is a statistically difference. But the right side is placebo, there is no statistically difference. And next slide is about the anti-cancer effects. It shows the tumor weight, and we put the mice, we used the sarcoma mice. We put the mice per oral, the component of Agaricus, blazei, cold water extract, and hot water extract. We confirmed the effect of anti-tumor effects on sarcoma 180. But as you know, sarcoma is not a naturally occurred tumor. Sarcoma is a transplanted cancer, so the evidence is not so strong about the anti-tumor effects. And here I want to introduce about one case study about the tumor in the dog. Its efficacy to the tumor. The dog is Shiba Inu, a dog. So before taking Agaricus, this dog is 15 kilograms, 9 years old, suffered from malignant lymphoma. Before this picture, there is a tumor on the face. So the dog is supposed to take a surgery on the face, but before that, the owner wanted to try to taking King Agaricus for their pets. So before the surgery, they start to take 900 milligrams a day of King Agaricus K21 for 3 weeks. And here is the after picture. The tumor has disappeared, and the dog didn't need to take any surgery. And here is also same dog. So after 1 year after this picture, after 1 year, the same dog also get the liver cancer. The above dog had high value in liver function, like here. And the owner tried various drugs for better liver function, but none of them improved their dog's liver. In the morning on 22nd September, the dog's stomach suddenly swelled like this. Then going to doctors and get the medical check. The dog is the tumor marker is examined. Here, tumor marker is 880. So after there is the number of the examination numbers. On the left side is before taking Agaricus. ALP, ALT, AST is very high. And from September 22nd, the dog started to take Agaricus, 10 tablets a day. And like this, the ALP is getting better after the 3 months. Also ALT and AFP is getting better. Here is a real picture document of examination result. So before taking Agaricus, ALP is very high. After 3 months, ALP is getting better. Also AFP before taking 880, and after 3 months, AFP is reduced to 80 to 88. Appearance is here. Upper side is before taking Agaricus. The liver is swollen, and after taking 3 months, the shape is become normal. Here is a change to before and after of the examination test. From here, I'm going to introduce about the antifungal infection of King Agaricus. Both of them, I want to introduce 2 human trials. Left side is 3 grams a day per oral for 3 months, and check the increase in anti-beta glucan subtypes, IgZ, IgM, IgA. And IgA is statistically increased after taking 3 months, 3 grams a day. According to this data, IgA is very related to the immunity, so it's very especially for okay, move forward. Okay, the right side is left side is 3 grams a day, and right side is 900 milligrams a day. So we try to check if we reduce the dosage, whether it works or not. The result is here. So just 900 milligrams a day, and here is 6 weeks and 12 weeks. We confirm the statistical improvement of the anti-beta glucan. The number of anti-beta glucan. And from here, I want to introduce about the clinical trial antifungal infection on dogs and cats. This is a midterm data, and the method is Internet Clinical Trial Service. We get this data this year, and subject is dogs and cats infected with fungal infection, malassezia, or dermatophytosis. The number is total is 97, but at this moment, I just introduced 56, and the body weight is from 5 to 6 kilograms without taking steroid, any steroid per oral. And dosage is 300 milligrams of Ka21 beta glucan, 1 tablet a day, and period use 1 month. Evaluation item is satisfaction of veterinary doctors, and also general health, like activity, food consumption, using 10 levels, visual analog scale, and symptoms, itch, redness, and dandruff, and oily skin, and follows. Also use the visual analog scale, 10 levels. The results is here. Here's all fungal infection. The number is 56. The satisfaction of the veterinary doctor. Here is very satisfied. 13 is very satisfied. Satisfied is 33. So more than satisfied is 82.1%. So we get very good feedback from the vet doctors. And here is general health. The number is small, it shows better. The number is bigger, it shows worse. And then here's activity and food consumption. So from 1 to 4 is very good, normal, and bad, and very bad. And statistically different, there is a big statistical different activity and also food consumption as general health. 37 is dogs and 19 is cats. Then let's move to each disease. The first, here is malassezia dermatitis. The number is 20, 14 dogs and 6 cats. The more than satisfied is 85%. Here's also the vet doctors also gave us good feedbacks. The number is here From 1 to 3 is no symptoms or mild. 4 to 6 is moderate, and 7 to 10 is severe. So small number is better. So it shows the symptom of marsupial dermatitis: itch, redness, dandruff, oily skin, and fur loss. All symptoms, we can see the improvement, statistically improvement. Here's each case. This is Zhu, a female dog of 3 years with contraception. Weight is 9.55 kilograms. Supplement taking K21 and anginol. This dog took 1 tablet of K21 per day for 1 month. Before its left side and after its right side. Yeah, after 1 month. Then veterinarian is satisfied, like itching was sufficiently suppressed. And each symptoms, including itchy, redness, scales, are improving like this. For scales, is 9 to 3. Now let's go to Malassezia external otitis, the otitis on the ear. And satisfaction of vet doctors is here. More than satisfied is 81.8%. Very good, good point. And each symptom is here: itch, redness, earwax, smell, and fur loss. All of these symptoms are improved statistically. This is a case. This is American cat, a cat of 1 year old. Weight is 2 kilograms. No supplement was taken before and after. Only Agaricus is taken. So half-size tablet daily taken, and drug was also ingested. So before, on the picture of the ear, before and after. So veterinary vet doctor was very satisfied. Outer ear environment become clearly better and less itching. Activity, appetite, itchy is 8 degrees from 8 to 4. Redness is also 8 to 3. There's a big, huge improvement of the symptoms. Next is dermatophytosis. Here is 2 dogs and 12 cats. Satisfaction of vet doctors, more than satisfied 78.5%. And symptoms here: itch, redness, and dandruff, and fur loss. All of symptoms are improvement. We can see the improvement. And statistic, itchy and redness and fur loss, there's a there is an improvement. We can see the improvement of these symptoms as statistically. So each case is here: dermatophytosis and Malassezia otitis externa. Here is a hybrid female dog of 6 months. Weight is 3 kilograms, 1 tablet per day. So no combination drug and supplement. Before taking K21 and after taking 1 month. So vet doctors say a dog's preference was very good. Otitis externa was improved. The owner was satisfied. There's a big improvement, especially to the itchy, from 7 to 3. Also the redness from 6 to 2. So far I introduced about improved immunity and antifungal infection. So let's move to reduce the side effect of chemotherapy. So I'm going to use the slide that used International Medicinal Mushroom Conference 10th. So the background of this data, we have the old data, bone marrow suppression leukopenia caused by cyclophosphamide. So when anti-cancer drug is administered to the mice, the white blood cell is decreased like this. But after taking, after that, the number of white blood cells is increased in the group which take agarics. So it is possible to improve the side effect of anti-cancer drugs, but this data is old, so we did new data. So the subject is 5FU. It's a kind of outpatient chemotherapy drug model. We selected this 5FU as outpatient chemotherapy model in human especially. And this is a model of test model. So we gave the mice 4 types of food, not water and control without any agarics, 5FU and control, 5FU and outdoor agarics, 5FU and indoor agarics. And we checked, we gave the mice 5 days 5FU per oral. Then we checked several points and appearance and other white blood cell and other points. The result is here. First, here is a mortality risk. So without any agaric group, here is the control group just taking 5FU. The survival rate is just 30%. But the mice group who took agarics indoor, outdoor, and indoor keep 70% of survival rate. And next is far condition after taking 19 days. Left side is control, and indoor is center, and right side is outdoor. As you can see, the far condition outdoor is better than indoor and control. And next is the protective effect on the digestive tract. When the digestive tract gets damaged by anti-cancer drug, the length of digestive tract is shorter. So we select the we select the length of digestive tract as the index of the damage of digestive tract caused by anti-cancer drug. So here is control, indoor, and outdoor. So the results here, outdoor group of the length of intestine keep longer than indoor and control group. Also, the length of colon, outdoor keeps longer than indoor and control. And it is incidence of diarrhea. The control group is more than 90%. They get the diarrhea, but outdoor group, the incidence of diarrhea is about 30%. And here's appetite recovery, the food consumption after 4 days. Comparing with the control and indoor group, they took more food than these groups. And here is a body weight loss. Here is the body weight. Here is a healthy control, and agaric group is here. Outdoor group is the black one. During the chemotherapy, the body weight is reduced, but according to thanks to the protective effect on digestive tract, so they can have the food more, so they recover quickly than the other groups. And here's kidney damage. King Agaricus 21 outdoor group, the kidney damage is smaller than control and indoor group, almost same as healthy control. And here is the recovery from leukopenia. Here here is the white blood cell count. So during the chemotherapy, all the group, the number of white blood cell is decreased. It shows supplementation of King Agaricus do not inhibit the effect of chemotherapy. It works, anti-cancer drug works, and after that, King Agaricus would recover quickly. So if the number of white blood cells do not recover quickly, they cannot do next step of anti-cancer drug protocol. So to keep the anti-cancer drug therapy, the recover from the leukopenia is very important to keep the therapy, chemotherapy. And here is also the side effect model. This shows the hair loss model, hair loss caused by anti-cancer drug model. The food is same, but just we shave the body on the mice for the first day after taking the 5-FU and check the how the number of recovery of the hair. Result is here. Upper side is control without any agarics. Center middle is an indoor group, and bottom is outdoor group. So outdoor group can see the higher percentage than the other group. So it shows once people also the dogs lost the hair or fur. If they take the King Agaricus, it recovers quickly after chemotherapy. So hair loss and weight loss is a very big issue for the pet owner to keep the chemotherapy. So many pet owner show their dogs their hair loss and weight loss. They wanted to stop the chemotherapy. So continue the chemotherapy. The prevention for the hair loss and weight loss is very important to keep the chemotherapy. Here's the conclusion. Outdoor control and indoor and outdoor group. Outdoor group has a strong protection, strong effect to anti-cancer drug, including leukopenia, appetite recovery, body weight, kidney damage, digestive tract, and hair loss recovery. So what is the difference between the indoor and outdoor? We think it's related to antioxidative activities. Here is Agaricus outdoor, and the second one is Agaricus indoor. It's Japanese indoor, and the other mushrooms. There is at that test we used the outdoor and indoor. So the difference between the antioxidative activity is related to the result of the effect of reduce the side effects of chemotherapy. So King Agaricus, outdoor King Agaricus is already has the evidence to anti-cancer activity and immune activation. So in this study, we confirmed the reduced side effects of chemotherapy effect. So King Agaricus not only improve immunity against cancer, but also improvement in the quality of life in cancer treatment. And then we also do the survey on veterinary doctors about the reduced side effects of chemotherapy. So we get the result from 24. So more than almost 80% veterinary doctors who use King Agaricus during the chemotherapy satisfied. So in this survey, at that test, we only used the 5-FU, but in this survey, many doctors use many types of chemotherapy, anti-cancer drug. So King Agaricus is assumed to be useful for many, not only 5-FU, but also many type of anti-cancer drugs to reduce the side effect of these kind of anti-cancer drug. So from here, so far I introduced the first session. So here's Q&A. Let's move to Q&A. So first question is if there are any side effect for human. There are two cases, mushroom allergy and digestive symptoms by rich dietary fiber. And is all agarics really safe? Following type of agarics caused liver dysfunction in the past. Other agarics blazei made in China, and also extracted agarics product. But King K21 has effectiveness of liver protection against these totally different from these kind of products. King Agaricus is and also King Agaricus is a high quality product manufactured in the GMP compliance plant, like this. King Agaricus product is manufactured at same level, same safety level, same quality as human supplement, and manufactured at human GMP licensed plant in Japan, and actually sell as human supplement in the other country. And here is the liver protection data. King Agaricus outdoor group has strong liver protection effect caused by drug-induced liver injury. So you don't need to worry about the liver injury, liver dysfunction like caused by other type of Agaricus products. And also the Q&A. So how about other animals? So we do the test, we have the data, and other animal also, so like horse, goat, pig, rabbit, dog, pig, chicken. So other animals also have anti-beta glucan activity, antibody. So it assumes to be useful for the other type of animals, not only dogs and cats. And here's a reference. There is some product, agarics product, agarics extraction products in the world. But according to the essay here, so we cannot extract full of beta glucan because beta glucan is the component of the cell wall. It's very difficult to extract. So there's some or many agarics extraction products, but the effect is getting weaker than normal agarics products. So according to this essay, we do not use any extract the beta glucan from the mushroom. We use the whole dried mushroom as ingredients. So far, let's move to second session. Please wait a moment. So let's move to second session. Second session is a quick recovery after injury. Oh, can I move to second session? Can I move to second session? Is it okay?
Yes, of course, you can move on.
Okay, so let's move to second session. So second session is a quick recovery after injury and surgery. And also I'm going to introduce about improved fur condition. First, I explained quick recover after surgery and injury. So this is a mice test model. So we gave the mice 3 types of feed: control without agarics, indoor agarics. The feed contains indoor agarics and outdoor agarics group. Then after we change the feed, we shave the fur of the mice, the backside, and we remove the skin using the biopsy tool and get the scar. So and we check the size of wound measurement on the 3 days, 6 days, 9 days, 12 days. And also we check the interleukin-1 alpha and collagen and TGF-beta. The result is here. After 12 days, the wound is here. Control, indoor, and outdoor. As you can see, the size of wound is very smaller than of the outdoor group. The size of wound is very smaller than control and indoor. Also, you can see the here is the wound repair percentage. The black one, square black one is the King Agaricus outdoor. So comparing with the control, there is a significant improvement, statistically improvement for 6 days and 12 days on. So KA outdoor improved the wound healing. Also, we checked some type of collagen and interleukin 1 alpha. So please see here collagen type 3. So after we get this injury, so after taking King Agaricus, the skin, the collagen type 3, the production of collagen type 3 is increased after injury to recover the wound. But for here, interleukin 1 alpha is related to the inflammation. So there is no difference in the interleukin 1 alpha related to inflammation. So after the surgery, so when the dog and cats get a surgery and taking King Agaricus, so there's not so related to the inflammation of the surgery, but we get the quick recover after the surgery from or injury. And then we get the good feedback from veterinary doctors after surgery. So number is 53. So we asked the doctors to use King Agaricus after surgery until remove the stool. So so after when we asked the veterinary doctors to give the dogs for 6 days after surgery, then we get the feedback from veterinary doctors, and more than satisfied is almost about 90%. Yeah, many doctors feel the improvement of the quick recovery effect by surgery. So according to this data, we recommend to use the King Agaricus for surgery, especially the wide area or injury. So next, let's move to improve the fur condition. Here's the fur loss model. We use the 3 types of mice: gray hair, white hair, and black hair. And these mice, the age is from 8 to 16 weeks old. So here is a hair cycle: growth period, regression period, and rest period. Hair cycle is a circle like this. But from 8 to 60 weeks old, these mice condition is considered to be in rest period. So if we shave the hair at this in this rest period, the fur do not recover quickly. But we try to move to rest to the growth period, whether control or indoor and outdoor Agaricus taking we want to confirm outdoor and indoor Agaricus group can move from rest period to growth period. So here is a test model. So we change the food, control indoor and outdoor, and after 1 week we shave the hair, and we can see, we evaluate whether we get the hair or not. Here's the result. Upper side is control, center is indoor, and the bottom one is outdoor. As you can see, outdoor get the hair more than indoor and control. Also, black and white mice. Outdoor is also outdoor group has strong hair growth effect. here's a result. This shows hair growth percentage, gray hair, black hair, and white hair, and control indoor, outdoor. So outdoor has strong hair growth effect, stronger than indoor and control. So next is we see the amount of hair growth. We also change the food and shave, and we check the hair growth score like this. Strong, weak, mild, strong. Here's a hair growth score. We put weak, strong like this. So in the gray hair, the hair is very short. We can see the just see outdoor Agaricus group get the hair. But the white, here's a white hair mice. So we can see the improvement, control and indoor and outdoor. There is a statistically difference between control and outdoor group. So we can see the hair growth effect. Outdoor is stronger than indoor and control. Here is a black mice. Yeah, at 13 days, we confirm the statistical improvement between Agaricus outdoor group and control group. So after we confirm the effect of hair growth effect in the mice test, we also do the human trial about the quality of life, including hair loss. So it's a human trial data, and we gave the people 9 milligram a day or 1.5 gram a day, 6 weeks and 12 weeks. And these improve the hair loss, gray hair, sensitive to cold, fatigue, easy to wake up. We can see these kind of symptoms, improvement of these kind of subjects. So we can see the improvement of the hair loss and improved gray hair. According to the gray hair, this data does not show the gray hair change to the black hair. Just this shows the amount of gray, the blonde hair feel the less gray hair after taking King Agaricus. So here's the reference data. We have the hair growth supplement containing the King Agaricus. Here is a monitor test. Female, 75 years old, before taking Agaricus supplement, 3 months, and after 6 months. As you can see, the improvement of the hair. And also herself or hairdresser see the improvement of the hair loss and the volume. Also the reference, as a reference, before taking Agaricus and after 3 months and 6 months. As you can see, the improvement of the hair condition. So let's move to the last part, other evidence and the summary. From here, I want to introduce about the newest data related to the longevity or other data, including extend the average life, keep motor function, and improve the microbiome, and survey on senior dogs and cats. It's the newest data. First is I want to introduce about the life extension effect. We do the test in the flies. Flies is usually used as an animal model for the life extension because the lifespan is very short. So we gave the flies indoor Agaricus or outdoor Agaricus and control groups. And here is the percentage of survival. And control group is black one, and blue one is house one, Agaricus, indoor Agaricus. As you can see, the survival rate of red line outdoor is better than the black and white one, black and blue one. So statistically, we can see the significant difference, statistical difference about the average life extension. comparing with indoor and control. And here is also the flies test. Fly has a habit to climb up. So if when the flies get old, they cannot fly on the upper side. So we count the number of climbing. And the name is climbing assay. Here is the percentage of climbing. Just start to the 7 days. Here is control, indoor, and outdoor. The climbing percentage of climbing is show the keep motor function against to the aging. From here, so 7 days, 14 days, 21, 28, 42 days. These days, you can see, as we can see, the statistically improvement keep the motor level comparing with the control and indoor by taking King Agaricus. Next is the improved microbiome test. So we gave the mice Agaricus or normal food. Left side is control without Agaricus, and right side is Agaricus group. After 7 days and 28 days, some specific microbiome is increased. After we do analysis, we show this one. This microbiome is Akkermansia mucinifera. So Akkermansia mucinifera is very nowadays. It get attention by in anti-aging society. So centenarian is more than 100 years old people. Inside their centenarian intestine, there are many Akkermansia mucinifera comparing with the short life people. Also, it calls anti-obesity microbiome. People who is inside the body of skinny people, I mean not obesity people, there is many Akkermansia mucinifera. But in obesity people, in their intestine, there's a few Akkermansia mucinifera. If we put the Akkermansia mucinifera to the obesity people, the body weight is reduced. So Akkermansia mucinifera is considered to have the anti-obesity and anti-obesity diabetes effect. Also, it shows it's considered to be useful for improving the efficacy of immune therapy, like the new anti-cancer drug, new drug, immune checkpoint inhibitors. And also here, I want to introduce about anti-stress effect. So we use the hypertension rat. Hypertension rats, their sympathetic nerve and their sympathetic nerve and parasympathetic nerve, this balance is disordered. So their autonomic nerve system is disordered, and the hypertension rat is all the time they're excited. So the blood pressure is we wanted to confirm the effect of adjusting the autonomic system and the anti-stress model as anti-stress model. We want to try to check whether King Agaricus can make the excited rat relax or not. The results here, red side is blood pressure. Blue one is a control group, hypertensive rat. And the red line is Agaricus group. Hypertensive rats, the blood pressure is increasing like this. But comparing with the hypertensive rat control group, Agaricus keep the blood pressure level low. And the right side is heartbeat. So the hypertensive rat is all the time they are very excited. So the heartbeat is a lot. The blue point is here. And Agaricus group, taking Agaricus group, keep the heart rate lower than hypertensive blood. So a result of this data, this data is the anti-stress model. So we can see the improvement of the heart rate and mean blood pressure. So taking King Agaricus is considered to be useful for stress, as anti-stress effect to adjusting the autonomic nervous system. So according to that data, we we recommend to take these kind of dogs and cats. So stress is related to these kind of symptoms. Leak fingers and skins by stress, and less appetite and diarrhea, and also problem behavior and bark. It's related to stress. So taking King Agaricus is considered to be useful for these kind of symptoms caused by stress. Next is the newest data. So last night I did analysis about this data, this data. So we do the survey on senior dogs and cats, and method is international clinical trial service, and from September to December. So subject is senior dogs and cats older than 12 years, which have some problems with general health, less appetite, and or less exercise, and or poor fur conditions. And total number is 164. But by yesterday, we just get 15 data, and we get the survey at we do the survey at 96 facilities at all, but we get just only 11 from the feedback from 11 facilities. And the subject is weight is 5 to 6 kilograms. The dosage is 1 tablet a day, and period is 2 months. Evaluation item is general health, exercise, food consumption, and fur volume condition and skin condition. And also we use the 10 levels visual analog scale. So, and here is the result. So one is the bigger number is better. So 10 is good, 1 is bad. So here's the result. So here general result: health before and after 2 months, appetite, skin condition, fur volume, fur growth, and exercise. We can see the improvement of these kind of symptoms, these kind of subjects, and statistical difference we can see at on general health and appetite and skin condition and fur growth. I think after we get more numbers, feedbacks, there is including we can see more statistical difference in this data. So according to this data, we introduce King Agaricus is considered to be useful to improve general health of dogs and cats, not only senior dogs, including general health, fur condition, and appetite and exercise. And we get some question about how you can see the improvement of their dogs and cats after taking King Agaricus. The answer is here. You can see the improvement of like this point after taking King Agaricus. Fur condition is getting better after taking King Agaricus, and appetite is better, and exercise. They started to do more exercise than before. So let's move the final stage, summary. Who we recommend to take King Agaricus? This is the last part. So according to the effect of improved immunity and antifungal infection, we recommend to take for cancer patient or cancer patient who are under the chemotherapy, or antifungal infection, malassezia, prevention and cure, also both, malassezia and dermatophytosis. And also you can see the improvement of the fur condition. So here as pet, we recommend to take our K21. Also here is reduce the side effects of chemotherapy. We get good feedback from veterinary doctors. So we also recommend under taking King Agaricus under chemotherapy to keep their condition better. Also, after surgery or injury, has quick recover. And stress-related symptoms, weak fingers and skin, less appetite, diarrhea, bug, and problem behavior related to stress disease, stress symptoms. And yeah, we can recommend to improve the general health of dogs and cats. General health, fur condition, exercise, and appetite. So this is last slide. King Agaricus will support your pet's QOL. Please ask your questions to provide more details about King Agaricus. Thank you for paying your attention.